the audiologist will discuss where you're hearing, if it's normal, if it's not normal, how you actually hear, and then what the steps are after that. So basically, if there's no loss at all, we'll go through a few different strategies that you might use in background noise or where you're having difficulties. We'll send a report to your doctor as well. If there is a loss found, but we think you need to have medical intervention that might help, we might send you on to a ear, nose, throat specialist or back to your GP just to have another look. If there's a loss found that could be helped with hearing aids, we'll then discuss what hearing aids do, and we can then discuss the further steps if you do want to trial a hearing aid.